Most of us are aware and are working around maternal health, but how many of us are aware of maternal mental health? Globally, 10% of women and 13% of postpartum women have experienced maternal mental health issues. This includes issues such as postpartum depression, postpartum anxiety, and sometimes postpartum psychosis. In Nivishe Foundation, whereby we deal with offering mental health and psychosocial support for teen mothers and adolescent mothers, we recently lost a young mom due to postpartum psychosis, whereby unfortunately they ended up unaliving themselves and their child because it was not actually noticed earlier. And this made us realize the urgency in making sure that we are addressing maternal mental health. So what was the gap? The gap was that a lot of mothers are already going through that from the data that I have mentioned, but unfortunately there were no immediate intervention, because even the caregivers, the practitioners around maternal mental health, the midwives, the nurses lacked information on what maternal mental health looks like, because it is a new thing, right? So what we decided at Nivishe Foundation is, how do we make sure that we're equipping mothers to be able to understand this and be able to actually know the signs and symptoms of certain issues, so that if they feel a change, they can be able to reach out for support, and for these practitioners to gain the necessary knowledge and information. So we created this WhatsApp chatbot. Why WhatsApp? It's because majority of us Kenyans, around 60 to 70%, have access to internet connectivities and have WhatsApp account. So instead of asking people to download new applications, which they rarely do, we decided to work with that. So the chatbot educates the mothers and their caregivers, and for the practitioners, the midwives, the nurses, they do modules on maternal mental health, and they get certification immediately. So how is that linked up together? So if I'm a mother and I'm coming to your center or the clinic for my normal clinical checkup as a mother, the nurse, the practitioner, the person there has the necessary knowledge. So apart from checking my physical symptom and my child's symptoms and care, they can be able to even monitor my mental health and well-being. And that is easily able to dictate what postpartum mental illness or maternal mental illness may arise due to complication out of these pregnancies, or just complications as a normal human being going through mental health issues. And if it is easily identified, then it easily leads to interventions, because the chatbot also offers referral pathway. So in the end, our main aim is, how do we integrate maternal mental health care to the primary healthcare system in Kenya, and hoping that we can reach to more people, not only in Kenya, but even outside Africa, because a lot of mothers outside there also are losing their lives due to that. So we are hoping that in the next few 1 year or so, we will have trained more than 2,000 community health promoters within Kenya. We've already started by training 300 of them. They already have the certification. Community health promoters, because they have direct access to these expectant mothers at the community level, and then training mental health practitioners and also nurses and people who are involved with mothers. And at the end of the day, we also are working towards a policy that will allow the Kenyan mental health directory or the Kenya Ministry of Health to actually prioritize maternal mental health care. So that is our work in making sure that we're protecting mothers' lives, not just physically, but mentally, and we're not going to lose mothers because of neglecting their mental health care during pregnancy.